Welcome back to Listen St. Louis with Carol Daniel on 9 PBS. Clarity, understanding, and empathy. Common values for those on the front lines charting a bold way forward for African Americans in St. Louis. Stay tuned as we talk to these change makers, visionaries, and overcomers. I'll ask the questions you want to hear and get the clarity we all need about the issues we face. That's next on Listen St. Louis with Carol Daniel on 9 PBS. There's been a major shift in St. Louis government. The popular health director resigned. The SLDC CEO agreed to step down, and the mayor lost re-election. I sat down with each of them, Dr. Hlatshwayo Davis, Neil Richardson, and Mayor Tishaura Jones, whose father, Virvus, joined us. What would they have done differently, and how best should the city respond to the deadly tornado? The exit interviews coming up on Listen St. Louis with Carol Daniel on 9 PBS.
Listen St. Louis with Carol Daniel is supported in part by Midwest Bank Center, Orvin and Latrice Kimbrough, the Betsy and Thomas Patterson Foundation, and the St. Louis Development Corporation.
Welcome to this special edition of Listen St. Louis with Carol Daniel. We are taking a look and a chat with several officials with the city of St. Louis who have left for a variety of reasons, including, we've already spoken to, Mayor Tishaura Jones and her father, Virvus Jones, and the former leader of the SLDC, the St. Louis Development Corporation, Neil Richardson. Well, today we're talking to, and she left because she decided to resign, Dr. Hlatshwayo Davis. Now, before we get to our conversation with her, you have some instructions, my friends. We would like you to subscribe to this podcast because we want to build those numbers. We want you to click the bell because that will alert you when new podcasts drop. We also want you to like the podcast, share it. I'm giving you a lot to do, aren't I? You can do it all. It's very easy. Share this podcast. I actually got a photo from a husband and wife who were out for a drive, and they took a picture of the screen in their car. They were listening to the podcast as they drove. They actually share the podcast with one another. If she gets it first, she shares it with him. If he gets it first, he shares it with her. I love this couple. I love it that you share this great information with other people. And we especially love the comments. Quick story. This is story number 2 before we get to my guest. We had the creator of Bold Spoon Creamery on the podcast. A friend of mine, colleague, listened to the podcast. She sent me a photo from Schnucks Markets. Bold Spoon Creamery, delicious ice cream. She listened to the podcast and immediately went to find the ice cream and sent me a photo. I said, girl, please leave that comment so people know the effect of Listen St. Louis with Carol Daniel. So I am so happy to have our guest with us today, Dr. Hlatshwayo Davis, who resigned as the director of the St. Louis Department of Health. Welcome back.
Thank you for having me.
Because she was one of our early guests on this podcast and now returning.
And can we have some commotion for the studio upgrade?
Yes.
Love it.
It is beautiful. We love these photos from the Missouri History Museum. Before we get to why you decided to resign, I should say, and when people hear this and see this, we'll still be in tornado recovery.
Yes.
What's the role of a health department in such a thing?
Integral, foundational. Tornadoes are storms. And besides the physical destruction, there's so many health elements. So our emergency preparedness department that you are so fortunate to have in your city health department is part of that first responder team. They're an incident command. They've been on the ground. They inform what safety around physical health and all of the things there within. If you go to the City of St. Louis's webpage and all of their social media right now, education on mold, right? And on tetanus shots. We have first responders right now, volunteers, community partnership and love like I've never seen before. That has been the first wave, that has been the front line. But they are in and about these structures and nails and rusted nails. And
The
so
inspections
tetanus,
are out of your department, correct?
exactly. Some of them are. And so tetanus shots are another thing that we are pushing. So we have emergency preparedness, but our Mental and Behavioral Health Bureau, that's a bureau that you know is close to my heart because I brought it to the city of St. Louis under the leadership of Mayor Jones in 2023. They are on the ground because there is so much shock, there is so much trauma, there is so much anxiety, depression that is affiliated with this. But then there's just real health concerns, right? What happens to people's pills, people's mental and physical ability to get to a doctor? Health and public health are integral to this. I'm so proud of the leaders that I see out there leading the charge. The City of St. Louis Department of Health, the T and the BRIC, the Village Keepers STL, the CHCM, the Integrated Health Network, and of course under the umbrella and auspice of the People's Response.
Yes.
Shout out to the People's Response. I've been out there on the ground with them. Phenomenal response through Action STL and for the Culture STL, the Urban League, St. Louis, and so many others have come together around this. The United Way, right? First on the ground, the Red Cross. It is truly inspiring to see.
And the role of the Department of Health in a declaration, a disaster declaration, which by the time this airs, we won't know if it has been signed. The governor must request the president to approve a disaster declaration. Governor Mike Kehoe has been here several times already and is working closely with the mayor and other leaders. But the role of the Department of Health in a disaster declaration is what?
So, I got the call from the mayor prior to my leaving to ask, is the administration kind of covering their bases? What are the thoughts and concerns? And again, that is why the Department of Health is in incident command from day zero to inform that response. Safety is a multifactorial thing.
Yeah.
So to be able to make that kind of decision and declaration, you have to really think about not only what is the physical damage to the city, but to human beings. And health, obviously, is a central part of that.
I will say that I've heard from several people regarding the color-coded of homes that have been inspected. And one young woman, and we're hoping to get an interview with her as well, who went into her home and decided to stay. She had a red card, but decided to stay. And her son has asthma. And had a severe asthma attack. That is one reason that the red card is there. This home is not safe to inhabit.
Yes, but we stand up fear that comes out of systemic and decades of racism, of being left behind in our communities,
of disinvestment,
There is valid mistrust and distrust. People are not willing to leave their homes because they are afraid that the moment they leave, their houses will be condemned, their homes will be taken away from them. And that is why communication is to
key.
Me an expertise and a skill and a key. I'm very grateful that there was an immediate pivot, but where did it come from? It came from grassroots advocates. It came from Black and brown grassroots advocates saying, this is not clear to us, right? This does not make clear to folks. Folks are afraid. We need you to do better and to communicate about what this means to folks. And then, again, this is where mental and behavioral health comes in, right? I had my own member of my team. I was in Florida, unfortunately, when the tornadoes hit for my my husband's brother's graduation. And one of our team members at the Department of Health lost half of our home was wiped out, would not leave. And there is also just a shock, an anxiety, and that is a classic trauma response right? So what are we doing to assist these people? And I'm so proud that the Department of Health has been central with other community-based organizations who specialize in mental and behavioral health about being on the ground. This is not about posting on social media, talking on TV. This is about walking door to door, as I did alongside Mayor Jones and Congresswoman Cori Bush during the floods. We went door to door and spoke to real people. You cannot do this from a distance. It has to be
on the ground,
meeting people where they are
on the ground. I had to put my glasses on for this question because I wrote this intro for you, and the word that I want to use in the intro is shocked. You shocked people when you announced your resignation, and so I know there are two answers to the why. One answer is a political one,
Yes.
and you are not a political animal, if you will, but you understand politics and the need to maneuver them. The other answer is the heart and soul of it. So, first of all, when did you decide to resign?
This has been a long-term decision. If you know me, and if you know how much I love the city and I love my team, there's no way that's a short-term decision, right? But I was also focused on the job, on the work, on supporting the team, bringing me in. But I watched the election like anybody else. Let's be honest. The obvious thing is anytime there's a turnover in administration,
Right.
that's an obvious time for reflection and a reset. But to think that this was a last minute decision means you just don't know me. And that's okay if you don't. But for those of you who do, you know that this is something I prayed about, pored over. My husband and I met with our pastor and first lady, our parents, and he and I are one unit. We are one band, one sound always. This was reflective and thoughtful over time. And then the decision was made.
But the handsome Jesse, because that's as he is known.
My man.
He, and I hope I'm not speaking out of school, but he has said to you over the years, when you are ready to sit down, you can.
Jesse Allen Davis does not play about me.
Yeah.
So at any point when the death threats came, the 2 times that I've had to have a police detail to pick up my kids from school, outside our home, Jesse's position has always been clear from day one, from October 21st, 2021, when I stepped into this role. He has been very clear. At any point that you need to leave, you can leave, right? We have worked extraordinarily hard that as individuals, we have choices and options. Right? I, as an infectious diseases physician, public health expert, he, as a pediatrician, vice president, and chief medical officer, we have earned that. We worked hard. We met each other as students. There was a time when I was sleeping on the couch of a girlfriend while studying for boards, right? We do not come from a lineage of family, but we have earned this.
Right.
So when he said that to me, he meant that. But the truth of the matter is he also knew that I'm empowered in that position too.
Right.
We have individually and as a unit, a partnership, prepared for all costs. And he has always said to me, if you need to go, you go.
Why did you get death threats?
This was during COVID-19.
Oh, okay.
Yeah.
Say no more.
Yeah.
Say no more. Say no more. So why then retire? That's the win.
Yeah.
And the win was a long time coming, but answer the why.
Simply, I chose me. More context to that. I've been really proud that I have been very intentional about modeling a career as a role model to young women, to young Black women, to all people. And I feel like I role modeled how to take a job. I humbly, but very honestly, remember what a big deal it was for Mayor Jones to announce an infectious diseases physician, public health expert, trained at some of the nation's premier hospitals as the city's health director. This was history. Right? She made history, as she has time and time again, in that announcement. That was role modeling. At the time, I remember going viral. I mean, I was national at the time.
You were on CNN.
I was on CNN, BBC. I came with my own platform, right? I'd been on CNN, BBC, and Al Jazeera for over a year at that point, really advocating for health equity during the pandemic. And so that role modeled what you can do, that representation mattered. I have tried to role model over the last 3.5 years how to keep a job, how to lead, how to build. I mean, I've almost doubled the size of the health department. We have built new bureaus, right? Under my leadership, we have built a behavioral health bureau, brought that to the city under Mayor Jones' support, brought a communications and community outreach bureau, we were in the red for every single audit fiscally. And we are now out of every high-risk designation for audits and built a contracts management system. So much more I could say. But I also role modeled how to leave. And it is okay. And so often women, specifically Black women, are not supported and given the space and the room to choose when we leave. Rest is earned. Rest is resistance. Rest is strategy for elevation, right? And those were the reasons for my why. Very simply. And I know people wanted more drama and they wanted me to be able to malign and say this and that. The choice was for me. It was for me. It was for my family. And I'm proud of that choice. I'm proud that it was a planned choice. I'm planned that I took my time, that I gave notice, right? By the time I had announced, my transition plan was done. My office could have been packed in 2 hours at that point. But we gave an extra month because that transition for the city and for my team was so important.
Would you have stayed had Mayor Jones won a second term? And have you thought about? I'm sure I'm not the first person
Yes.
to ask you that.
Yeah, I that was always on the table, considering if it was time for me to transition out. But obviously, there was a much higher likelihood of me staying. And let's be clear, this is, again, not drama. This is the woman, a historic mayor. Forget what the press wants to rewrite history, right? This is a 20-year veteran in politics, a woman who built a historic cabinet. We had never before seen the level of talent, the level of diversity, inclusion, female leadership, and not for its own sake, right? Again, my numbers speak for themselves, but so do those of many of my colleagues, right? This was a woman who brought me in. I wouldn't have said yes to anyone else at the time. I came because she asked. I came because of the need. I became because of the pandemic. I did my job, and I get to leave. But of course, the woman that sponsored me, the woman who put me in this position, there is no Dr. Mati for the city of St. Louis. There is no community doctor if it weren't for Mayor Jones. So of course she gets that loyalty. Of course she gets that consideration. And why that would be news is quite frankly shocking to me. It doesn't take away from anyone else, but a fact is a fact.
And because you came during the pandemic, and because I met you right away, I began interviewing you right away. I was still a journalist on radio. I knew right away that you, like other public health directors, were under threat, if you
Yes.
will. And so did it begin right away for you? And did it ever ease up, even
yes.
as the pandemic?
I mean, you have to consider that I didn't come in as the director for this beautiful city at the beginning. I came in a year and a half into the response.
Right.
There are a lot of big feelings, strong feelings.
Already.
I had 2 weeks to announce, to come up with a plan for the pediatric rollout. I mean, I was at a news conference with Mayor Jones the same week. Right? I was a month away from announcing Omicron. So this was nothing new. But I also was a national voice. I took us from being a city health department to regional, state, national, and even global. We have won national acclaim, right? We have been invited to the White House. And so with that comes a lot of attention, a lot of scrutiny. And unfortunately, in my case, the death threats came.
And you have facts that you could lay out. You have the emails, the letters, the calls from people who led their disgust or mistrust or anxiousness or whatever you want to call it, whatever emotion you want to tie to that, who led those complaints with your gender and your ethnicity.
Oh, yes. I was called every name. I was told to go back to Africa. I was told I was a DEI hire. I was told I was likened to animals. They found pictures of my family and made threats under those. Emails came. I remember calling the chief of police, and he was upset with me at the time for not calling him sooner. It was he who insisted on the investigation and on a detail at the time until that investigation was complete. That's not something I requested. And so when people who are in the police who this is their career say, no, we're not comfortable with this, you listen. I don't regret it, but I would never lie to you and say that wasn't completely one of the most scariest things I've ever gone through. It's different when it comes to you, and I think you can relate to this.
Yeah.
I'm always like, come for me. I can handle it. But I have children, Carol, right? My babies at the time, my youngest was 3 at the time. Right? There is nothing that will cripple you with fear more than a threat to your family.
Do you have any regrets? You don't. You first of all, you don't strike me as a woman who has regrets because you're going to do the thing and say the thing in the moment that needs to be said and needs to be done. And so you don't strike me as a woman who will walk away with regrets because you're going to do what needs to be done in the moment. But do you have any regrets?
Not a one. And that's without being fake. I would never lie to you. I'm going to keep it real. This was one of the hardest jobs. I have seen the lowest of the low, been treated sometimes awfully. There were times I would see my kids at the height of the pandemic only twice a week while sleeping in the same house as them. I gave my health to this job, both physical and mental, at many points. It was, at the same time, one of the hardest and worst experiences, but literally, I will never, ever be able to thank Mayor Jones enough for the joy, for the opportunity, for the history, for the love, right? I knew I loved the city, but there is that love story deepened during the last 3.5 years. To be able to drive to community-based organizations, Miss Ollie's, right? To be able to just walk through the door, hug her, right? To be able to be admonished by her, held accountable, right? To be able to call, whether it's Mike, Pastor Burke, all of these people who took me under their wing, I have zero regrets. I will never, and I'm very aware, acutely aware, that I will never have the experience of leading and working and serving the way I was able to for the last 3.5 years.
And we need to be clear that there have been others who led the health department
Yes.
with the title of doctor.
Yes.
But you are the first medical doctor, am I correct?
I'm the first Black woman physician. There has
that's
been
it.
there's been at least one other physician that I'm aware of. There have been countless other public health experts. I think of Melba Moore,
Yes.
the Black woman who opened the door. She
Right.
walked so I could run. And she, when I had no orientation, there was no binder or no, onboarding plan waiting for me. I made sure to build that for the next person because I know what that can feel like. She offered to give me a biweekly Zoom call if I so wanted it from her job halfway across the country. I mean, who does that? She didn't owe me that. So I stand on the shoulders of giants. All of my predecessors left their own mark in history, and I'm proud to say that I did the same.
What weren't you able to accomplish?
Oh, there was so much more I wanted to do. I wanted to see the health department's budget grow to
Because it is what?
It is, I inherited less than 1% of the city's budget.
Right.
I'm so fortunate that I had an administration that supported me to now having just over 2% of the city's budget, but it's still woefully inadequate. To have a health department that has no formal clinical services is a disservice to the city, disservices to families and the children of this city. To have it, and that happened over a decade ago. Mayor Jones inherited that, as did I. To have a health department that is below the threshold, the minimum threshold that the WHO calls for. The WHO says any city that is worth its weight should invest at least 5% of the city's budget into its health department. There are many African cities that invest more into their health departments than most American cities, including St. Louis, and that's unacceptable.
And so, and we compare that to city size, or do we use the city's condition?
Yeah. Thank
as
you
a
for
way-
asking that. That's such
Okay.
a great question. I don't just make that, it would be ridiculous for me to compare our budget to New York or San Francisco's. Completely different beasts. But one of the analyses I did, I only had 2 epidemiologists when I took over the health department. I've grown that to 11 because I believe, as my friend Dr. Corey Bradley says, data is justice. So I've been a data-driven. I keep a receipt, Carol. I'm not going to argue with you for too long. We can go back and forth, but I'm just going to slide the receipts across the table. And one of those receipts is we looked at cities of comparable size, of comparable demographics, and comparable issues. And even for that, we are at least 4 times smaller than we should be. And our budget is at least that same size smaller. Look at the county, our neighbor. That department is 5 times greater than my department, has 5 times almost a greater budget, has clinical services. The city deserves more. And that's something I was fighting for. It's a proposal I gave once I was invited to by Mayor Jones, who also fought for this proposal for the Rams money. To get $0.00 allocated to health is unacceptable. And it is not acceptable to say because there wasn't enough community outcry for it, because we know that there is health illiteracy. We know that people do not feel high blood pressure as distinctly as they feel someone breaking into their house or hitting a pothole. We know that. So we have to be the responsible leaders to say there is a small amount, and I'm talking even 1%, less than 1% of Rams money that could be allocated to health, but we deserve more. We saw Homer G. Phillips shut down.
Right.
That is a building we could have brought. We can reclaim that name on behalf of the city's health department. So many ideas that I wanted for this health department, but I'm proud to say that I have left a legacy where now we have 2 subcontractors working on those very issues, really looking at what we can do to support our other hospital systems, our FQHCs, but there is still not enough. There is more that is needed, and there's certainly more that is needed from your city health department by way of clinical services.
The question becomes then, what's your understanding now of why? Why we know that we are not healthy in the city. Some are. I always use the Tale of Two Cities, the first line, the first paragraph. It was the best of times, it was the worst of times.
Right.
In the Central West End, it's the best of times, right? In North City, it's the worst of times.
That's right.
So we are very healthy. I drive through Forest Park, and people are jogging and playing tennis and handball and picnicking and going to the Muni and the zoo, and it's a healthy environment for some. They're biking, right? They're cycling, but it's also a very unhealthy city. And so the question then becomes, why? Why do we not see the writing on the wall and do more to improve the health? Or is it because you're unhealthy because it's a decision you made and it's your fault?
That is a podcast unto its own. I could break down all of that, but let's start with history. This goes back to slavery, when the bodies of Black people were not given consent, when we were used as experiments, where we were not given the same. This has been carried down in history. And again, you can argue this all day, but argue with your mama, like the kids say, because the research shows it, right? There is a systemic and structural disinvestment into the health and wealth of certain people, certain neighborhoods, and certain zip codes. The research has been done here in St. Louis, right? Popular study done by a group of folks here, Dr. Jason Purnell being one of them, shows that you can move within 5 miles and the life expectancy will drop by an average of 5 to 7 years. Unacceptable. Right? That doesn't happen overnight. And while some people may be tired of hearing about history, if you ask about why, it is rooted in history and in modern day decisions. If you look at the federal cuts that are coming from this administration at this time, they are disproportionately affecting the most at risk and the most minoritized amongst us. That is a choice. It is historically and currently rooted. That is the why.
So do you leave with hope? Or do you leave with some amount of despair, or both?
I leave with both. I know what we did. I know what this health department represented. There are folks who talk about public health who didn't ever. Like I said, we've almost doubled the size of that health department at its lowest. We were down to 85 people in 2021 when I left, over 140 folks, right? We built a culture. We were in community, right? We put millions of dollars back into community, whether it's through ARPA funds that Mayor Jones empowered us to have and to reinvest back into community, whether it's in the most innovative programs, right? Community-based events, we did that. I'm proud. That gives me hope. I know the community partners. I had babies in the health department who said, if you leave, I leave. And what I'm most proud of is them coming to hug me with tears and saying, I got next and I will continue that legacy. I get texts. I got one today. I'm on a call. Your babies love you. Oh, this health department, they miss you. Yes, we're still doing this work on your behalf. That gives me hope. But I have despair because I'm not going to rewrite a story. While the tornadoes are a story of now and will be a story for years to come,
right.
We will be in recovery for years to come. We can walk and chew gum now, and there are still federal cuts coming. The day that I got my first 4 federal cuts, that was almost amounted to a total of $5 million. One of them, a food program to feed seniors in partnership with the YMCA in some of the poorest neighborhoods in St. Louis. Tell me how that makes America healthy again. Tell me how that's about efficiency and cutting costs. I actually agree with Make America Healthy Again. I want to make America healthy. I believe in efficiency, and I believe in saving money. If you're the director of a health department, especially one with only 2% of the city's budget, all you do is work on efficiency and saving costs. This is not it. This is willful, destructive, willful negligence. It is unacceptable. And so I do leave with despair, and I leave saying that this wasn't a resigning to just sit. I'm going to rest now. Don't get it twisted. I'm going to swim. I'm going to eat. I'm going to watch Bridgerton for the 4th time if I so choose. But it is also choosing the where and the how of my advocacy and my activism.
What is your advice? And what is your advice for Mayor Spencer? We are going to look at her 100 days here at 9 PBS. What advice do you have for her, if any?
I'm proud to say I had those conversations. I offered myself to meet. I left a transition plan. I typed it out. It is available to her office, to the health department. Continue to listen, follow that track record. I left a plan for how to have a cost neutral, not 1 cent of cost to the city, to save all of the employees that are hired under federal cuts and key programs. I left instructions around some of the key issues that we are facing, both on the fiscal side, for animal care and control, for a lot of the priorities. I left that. I had those conversations face to face. I had them on the phone, and I put them in writing. So to me, it is just actively listen, read them, follow them as much as you can. And listen, I know that I had the luxury, right? I know that not being a mayor and actually being a health director, that I have one department and they have many. But there is a vast difference between 2% of the budget and over 52% for public safety. Our police force deserves support, but there are ways to support us all and make it a balance that benefits all. I am proud to have worked with our public safety. I've almost collaborated with every department in the city to provide training, support, and that doesn't happen without health. Support health, fund health, and get those resources.
I can't let you leave without asking you this question that we are asking all of our guests this season 2, by the way. And that is based on the name of the show, Listen St. Louis with Carol Daniel. Who should we, Dr. Madi Hlatshwayo Davis, who should we be listening to?
Listen to public health workers. Listen to food inspectors, community sanitation officers, community health workers, the supervisors and the managers who do this work every day. I am because of them. All of the accolades, all of the awards, this name recognition is built on the foundation of public health workers who do this work day in and day out. Listen to them.
Dr. Madi, thank you. And she's not leaving St. Louis, by the way. This is now home. Thank you so much for joining us on this special episode of Listen St. Louis with Carol Daniel.
Thank you for having me.
Appreciate you. And congratulations.
Thank you for modeling this for me. You know, I watched you. I watched how you chose to leave. I watched how you elevated and you advocated. You are a mentor to me, and I honor you today. Thank you.
Thank you, my sister. And thank you for joining us for another episode of Listen St. Louis with Carol Daniel. We so appreciate your time. We appreciate your attention. And here's your job. Subscribe, share, like, and comment. Oh, and hit that little bell that you will be able to be notified when new episodes drop. Thank you so much for joining us for another episode of Listen St. Louis with Carol Daniel right here on 9 PBS.
Listen St. Louis with Carol Daniel is supported in part by Midwest Bank Center, Orvin and Latrice Kimbrough, the Betsy and Thomas Patterson Foundation, and the St. Louis Development Corporation.